Good evening. This is All India Radio. I am Manoj Singh Rana and with me is R.S. Raghu with the evening news. The headlines. Prime Minister Narendra Modi stresses on constant innovation and dynamic methods to deal with COVID-19 as the virus is continuously changing its form. Centre urges states and union territories to make mucormycosis, also known as black fungus, a notifiable disease under Epidemic Diseases Act 1897. Over 18 crore 70 lakh COVID vaccine doses administered in the country so far. Government says continuous improvement in recovery from COVID-19 being noted in the country from 3rd of May. Active cases also on declining trend. National recovery rate of COVID-19 improves to 86.74%. Over 276,000 new cases reported in the last 24 hours. Defence Minister Rajnath Singh lauds efforts of armed forces and Indian Coast Guard in rescue operations following Cyclone Tauktae. Sports Authority of India to extend medical and accident insurance cover to more than 13,000 athletes, coaches and support staff. Income Tax Department to launch new e-filing portal on the 7th of next month. And in Kerala, new cabinet led by Chief Minister Pinarayi Vijayan assumes charge today in Thiruvananthapuram. As the number of COVID cases is on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years of age who have taken the first dose of COVID-19 vaccine to get vaccinated with a second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi has stressed on constant innovation and adoption of dynamic method and strategies to effectively deal with the challenges posed by COVID-19 pandemic. He said this virus is continuously changing its form and the scientists are working to deal with the mutant virus. The Prime Minister interacted with the district officials of 10 states on the COVID-19 situation today.
कोरोना के इस काल ने आपके काम को पहले से कहीं अधिक चैलेंजिंग और डिमांडिंग बना दिया है। महामारी जैसी आपदा के सामने सबसे ज्यादा अहमियत हमारी संवेदनशीलता और हमारे हौसले की ही होती है। इसी भावना से आपको जन जन तक पहुंचकर जैसे काम कर रहे हैं उसको और अधिक ताकत से और अधिक बड़े पैमाने पर करते ही रहना है।
Mr. Modi has said amid the second wave of coronavirus, the mutant virus is posing a concern for adult and children. He asked the state administration and district officials to prepare for this challenge by evaluating the data related to seriousness of this infectious disease. Highlighting the need to avoid wastage of COVID-19 vaccine, Mr. Modi said wastage of a single dose of vaccine means not being able to provide the necessary protective cover to one life. He said the Union Health Ministry is providing the information for the availability of the 15-day stock of vaccines to states and union territories.
टीकाकरण की रणनीति में भी हर स्तर पर राज्यों और अनेक स्टेक होल्डर से मिलने वाले सुझावों को शामिल करके आगे बढ़ाया जा रहा है। इसी क्रम में स्वास्थ्य मंत्रालय की तरफ से 15 दिन के टीकों की उपलब्धता की जानकारी राज्यों को दी जा रही है। वैक्सीन सप्लाई टाइमलाइन की स्पष्टता होने से टीकाकरण से जुड़े मैनेजमेंट में आप सभी को और आसानी होने वाली है।
Stressing on the implementation of the COVID-appropriate behavior, the Prime Minister said adoption of such behavior is the major tool in the fight against COVID-19. Appreciating the role of district officials in the fight against the COVID-19 pandemic, the Prime Minister has said work done at the field level and the experiences and feedback shared by the district officials will help in making practical and effective policies.
गांवों में कोरोना टेस्ट की सुविधा अधिक से अधिक लोगों तक पहुंचाने के लिए मोबाइल वैन का तरीका कई लोगों ने अपनाया है। स्कूलों, पंचायत भवनों को कोविड केयर सेंटर्स में परिवर्तित करने का कुछ लोगों ने इनिशिएटिव लिया है। आप लोग खुद गांव-गांव जाते हैं, वहां की व्यवस्थाओं की निगरानी करते हैं, आप ग्रामीणों से बात करते हैं, तो इससे जो वहां का सामान्य नागरिक है या वहां के गांव के जो लीडर लोग हैं, उनको जब शंकाओं का समाधान होता है और डायरेक्टली आपके साथ जुड़ते हैं, तो उनका आत्मविश्वास अनेक गुना बढ़ जाता है।
The Prime Minister has said that our priority is also to keep life easy along with saving lives. He said there should be facilities of free ration and other essential supplies for the poor.
The Union Health and Family Welfare Ministry has urged the states and union territories to make fungal infection mucormycosis known as black fungus a notifiable disease under the Epidemic Diseases Act 1897. The ministry has asked all the government and private health facilities, medical colleges to follow guidelines for screening, diagnosis, management of mucormycosis issued by the Union Health Ministry and the Indian Council of Medical Research. In a letter written to all the states and union territories, Joint Secretary in the Health and Family Welfare Ministry, Love Agarwal, has asked the health facilities to make it mandatory to report all suspected and confirmed cases to the Health Department. The Tamil Nadu government has declared mucormycosis as a notified disease today. The State Health Secretary Dr. Radhakrishnan has said that hospitals should inform such cases to the government immediately. The state recorded more than 35,000 fresh COVID cases today. Chennai is witnessing a downward trend and the total number of COVID cases is 6,073. More from our Chennai correspondent.
According to Health Secretary Dr. Radhakrishnan, 9 patients were identified for the mucormycosis disease in the state. The secretary told that there was no need to panic as the disease was treatable. The state has formed a 10-member team including medical experts from ENT, neuro and other fields. He said that it was time for people with mild symptoms of COVID to immediately quarantine themselves, not waiting for the results. In another move, district officials of Tiruvallur stopped the shooting of the Bigg Boss Malayalam show at Poonamali near Chennai. Joy, AIR News, Chennai.
The government today asserted that the shortage of amphotericin B used for the treatment of mucormycosis will be resolved soon. Minister of State for Chemicals and Fertilizers Mansukh Mandavia said that within 3 days, 5 more pharma companies have got new drug approval for producing amphotericin B in India, in addition to the existing 6 pharma companies. He added that the existing pharma companies have already started ramping up the production. The minister informed that Indian companies have also placed orders for importing 6 lakh vials of amphotericin B.
The Indian Railways is continuously engaged in delivery of liquid medical oxygen to various states and union territories. The Ministry of Railways has said that Oxygen Express trains have delivered nearly 12,630 metric tons of liquid medical oxygen in more than 775 tankers across the country so far. The Union Health Ministry has said that continuous improvement in the cases of recovery from COVID-19 is being noted in the country from the 3rd of May. The active cases of COVID-19 are also on a declining trend in this period. Addressing the media, Joint Secretary in the Health Ministry, Love Agarwal, said that the number of active cases has come down to 12.1% from the level of 17.13%, while the recovery rate has improved to 86.7% from the level of 81.7% on the 3rd of May. He said,
पिछले 10 दिनों में अगर हम डेटा का आकलन करें तो पाते हैं कि रिकवर्ड केसेस आर मोर देन द एक्टिव केसेस, जो कि एक बहुत पॉजिटिव ट्रेंड है. आज भी हम देखें तो पाते हैं कि हमारे एक्टिव केसेस 69% के करीब एक्टिव केसेस अभी केवल 8 स्टेट्स में लिमिटेड हैं और 21 स्टेट्स देश में ऐसी हैं जहां पर की रिकवरी डेली रिपोर्ट होने वाले केसेस से अधिक है. 13 स्टेट्स ऐसी हैं जिन्होंने पिछले 24 घंटे में 10,000 से ज्यादा रिकवरी भी नोट की गई हैं.
He also mentioned that 6 states, Karnataka, Kerala, Maharashtra, Rajasthan, Uttar Pradesh and Gujarat, which were the major contributor in active cases, are now showing a decrease in these cases. He stressed on the need to ensure continued efforts at containment levels in the states reporting decrease in active cases. Mr. Agarwal also informed that India has witnessed a consistent upward trend in weekly tests since mid-February, with average daily tests increased by 2.3 times in last 12 weeks. He said,
पिछले अगर एक हफ्ते में देखें तो 1 करोड़ 30 लाख के करीब टेस्ट भी देश में किए गए हैं, यानी कि टेस्टिंग की गति करीब 2.3 टाइम्स हमने पिछले 12 हफ्तों में बढ़ाई है। अब तक देश में करीब 32 करोड़ से अधिक टेस्ट हो चुके हैं। हाईएस्ट सिंगल एवर टेस्ट डन 20 लाख से अधिक पिछले 2 दिनों में किए हैं और पिछले 24 घंटों में 20,55,000 टेस्ट देश में हुए हैं। देश की पॉजिटिविटी पिछले 10 दिनों से 20% से कम नोट की जा रही है और लोएस्ट पॉजिटिविटी रेट करीब 1 महीने बाद 13.31 देश में कल नोट किया गया।
During the briefing, Director General, Indian Council of Medical Research, Dr. Balram Bhargav, stressed on the need to increase testing with a view to further bringing down the case positivity rate to 5%. Dr. Bhargav informed that the government has set a target of conducting 25 lakh tests per day by the end of this month and 45 lakh tests per day by the end of June.
Over 18 crore 70 lakh COVID vaccine doses have been administered to the beneficiaries so far. The Health and Family Welfare Ministry has said that over 11,66,000 vaccine doses were administered to the beneficiaries in the last 24 hours. India had launched the world's largest vaccination drive on 16th of January this year. The Government of India has been receiving international cooperation of COVID-19 relief medical supplies and equipments since 27th of the last month from different countries and organizations. These are being promptly dispatched and delivered to the states and UTs. More than 13,000 oxygen concentrators, 15,000 oxygen cylinders, 19 oxygen generation plants, 10,000 ventilators or BiPAP and over 6 lakh remdesivir vials have been delivered or dispatched through road and air till now. In the last 2 days, major consignments were received from Canada, Kuwait, Oman, Myanmar, USI SPF and UK Medical Aid International. Effective immediate allocation and streamlined delivery to the recipient states and UTs and institutions are ongoing exercises. The Health Ministry is comprehensively monitoring it on a regular basis. A dedicated coordination cell has been created in the Union Health Ministry to coordinate the receipt and allocation of foreign COVID relief materials as international cooperation in the form of grants, aid and donations.
India remains engaged with US entities on the prospect of procuring vaccines from them and also manufacturing the vaccines in the country. Briefing the media, External Affairs Ministry spokesperson Arindam Bagchi said this will augment India's vaccine availability. He said India has noted the recent announcement by the US of its intention to make some vaccines available to other countries. Mr. Bagchi emphasized that all vaccines that may be procured from abroad would need to be as per India's regulatory guidelines. Replying to a media query, the spokesperson said many countries have expressed solidarity with and support to India in the fight against the second wave of COVID-19 pandemic. He said over 40 countries have supplied COVID-related equipments and materials to India through the Indian Red Cross Society. On the Israel-Palestine conflict, Mr. Bagchi said India is closely following developments in this regard. He said on the 16th of this month, India's permanent representative in the United Nations made a detailed statement on the subject during the open debate of the UN Security Council. The spokesperson said India is expected to make a statement on the issue at the UN General Assembly in a day or two.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi stresses on constant innovation and dynamic methods to deal with COVID-19 as the virus is continuously changing its form. Centre urges states and union territories to make mucormycosis, known as black fungus, a notifiable disease under Epidemic Diseases Act 1897. Over 18 crore 70 lakh COVID vaccine doses administered in the country so far. Government says continuous improvement in recovery from COVID-19 being noted in the country from 3rd of May, active cases also on declining trend. National recovery rate of COVID-19 improves to 86.74%. Over 2,76,000 new cases reported in the last 24 hours. Defence Minister Rajnath Singh lauds efforts of armed forces and Indian Coast Guard in rescue operations following Cyclone Tauktae. Sports Authority of India to extend medical and accident insurance cover to more than 13,000 athletes, coaches and support staff. Income Tax Department to launch new e-filing portal on the 7th of next month. And in Kerala, new cabinet led by Chief Minister Pinarayi Vijayan assumes charge today in Thiruvananthapuram. For quick news updates around the clock, follow us on Twitter at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the evening news. A village in Maharashtra's Ahmednagar district, Hivre Bazar, has become COVID-19 free due to the constant efforts of its Up-Sarpanch, Popat Rao Pawar, whose emphasis on early detection and treatment is working wonders, even at a time when the state is reeling under the second wave. A report.
Ahmednagar's Collector Dr. Rajendra Bhosle informed Prime Minister that the district is strictly implementing My Family, My Responsibility and the My Doctor campaigns to ensure that people with comorbidities are taken care of and do not face any medical issues. Talking about Hirve Bazar, Dr. Bhosle said 4 teams were formed to survey each household for symptoms. Rapid antigen tests were conducted besides RT-PCR for early detection and isolation. Any person found to be positive was immediately quarantined and treated as per protocol. The district collector said Ahmednagar is working to install oxygen plants at 14 rural hospitals that will augment oxygenated bed capacity by 1,750. Nisha Rani, AIR News, Mumbai.
Union Minister of Petroleum and Natural Gas and Steel Dharmendra Pradhan today inaugurated augmented ventilator facilities at the Ispat Postgraduate Institute and Super Speciality Hospital of SAIL in Rourkela, Odisha today. Addressing the virtual event, Mr. Pradhan said that the upgraded ICU facility is a significant addition to the healthcare infrastructure in the region and will boost Odisha's fight against COVID-19. The virtual event was attended by Union Minister of State for Steel Phaggan Singh Kulaste, among others. More from our Bhubaneswar correspondent.
Underlining the significant contribution of the steel industry to the nation's fight against the pandemic, Mr. Pradhan disclosed that the liquid medical oxygen supply by the steel plants have been ramped up from 538 metric tons as on the 1st of April 2021 to over 4,400 metric tons per day. He said that the Rourkela steel plant has supplied more than 9,653 metric tons of life-saving medical oxygen to various states. He said the Rourkela steel plant has also set up a virology laboratory in the Ispat General Hospital, which has been enabling quick COVID testing, with about 550 tests being conducted as of now. Girish Chandra Das, AIR News, Bhubaneswar.
Karnataka Health and Medical Education Minister Dr. K. Sudhakar has said that 25 oxygen concentrators will be provided to each district with higher number of COVID-19 cases. Speaking to the media in Bengaluru today, the minister said that the state has received 800 concentrators recently, which will be distributed to Hassan, Mandya, Chikkaballapur, Kolar and Chitradurga. More from our Bengaluru correspondent.
The Health Department is making efforts to provide ICU facility and oxygen in all the medical colleges across the state. Chief Minister has decided to provide 50,000 rupees advance to all Gram Panchayats. Village Task Force Committee will utilize this fund to shift COVID patients to care centers. The Health Minister has requested public representatives to participate actively in COVID containment activities. He said that positivity rate is at 27% and the aim is to reduce it further by 5%. Efforts are also made on reducing mortality rate. He informed that IIT Kanpur has provided database research inputs and has also advised on this. Sudhindra, AIR News, Bengaluru.
Assam Chief Minister Himanta Biswa Sarma has urged people of the state to make the COVID vaccination drive a mass movement. Talking to newspersons in Guwahati this evening, the Chief Minister appealed to people to financially contribute in the vaccination drive. He said that 35 lakh people have been vaccinated so far in the state. Mr. Sarma said that the overall COVID situation during the last 3 days has shown a ray of hope. Meanwhile, Health Minister Keshav Mahanta today visited Saru Sajai Stadium in Guwahati to take stock of the construction work of 300-bedded COVID hospital by the DRDO.
Meghalaya Chief Minister Conrad K. Sangma today inspected the installation works of the 150 LPM liters per minute oxygen plant at Nongpo Civil Hospital in Ribhoi district. The plant will provide high-flow oxygen to 25 beds that will also cater to the oxygen needs of COVID patients. The plant is likely to be functional by early next week. The UNDP-funded oxygen plants are also being set up in other important towns, Tura in West Garo Hills District and Joai in West Jaintia Hills District. During his visit, the Chief Minister also discussed with officials on setting up another COVID base at the Maternity and Child Hospital at Umran Niang Barnai. The Chief Minister informed that ramping up of health infrastructure is going on a war footing. Education Minister Ramesh Pokhriyal Nishank today chaired a meeting with directors of IISc, IITs, IISERs and NITs through video conferencing and exhorted that there is a need to maintain the quality education in these institutes of national importance besides taking adequate safety measures for managing COVID-19 situation. He reviewed the status of imparting online education and virtual laboratory courses by these institutes.
The government has issued guidelines for the care of elderly during the ongoing COVID-19 pandemic. In the guidelines issued in the month of April, several do's and don'ts have been issued for the elderly, their caregivers and NGOs taking care of the older people. Talking to All India Radio News, B.L. Meena, Director in the Ministry of Social Justice and Empowerment, said if any senior citizen is abandoned by the family, then they can approach the tribunal or the police station for their care. More in this report.
Elderly are more vulnerable in the pandemic and the government has taken adequate measures to take care of them. Talking to AIR News, B.L. Meena informed that there are more than 440 NGOs that are working for the elderly in the country and they are managing more than 650 senior citizen homes. Mr. Meena added that if any senior citizen is abandoned, he can approach the tribunal or police station for assistance.
As per Maintenance and Welfare of Parents and Citizens Act 2007, if children or relatives neglect or refuse to maintain a senior citizen, then he can contact to tribunal or police station. The maximum maintenance allowance ₹10,000 may be ordered by tribunal as per the Act. We are in the process to remove this ceiling of ₹10,000.
COVID-19 is a difficult time for one and all. Stay home, stay safe and follow all the COVID guidelines. Diksha Saxena, AIR News.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Piyush Ranjan, Department of Medicine, AIIMS will participate in the discussion. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates.
Defence Minister Rajnath Singh has lauded the efforts of the Armed Forces and the Indian Coast Guard for the ongoing search and rescue operations in areas affected due to Cyclone Tauktae. He commended the Indian Navy and the Indian Coast Guard for saving the lives of people stranded at sea. He also hailed the Indian Army for deploying its columns in affected areas and the Indian Air Force for transporting personnel of the National Disaster Response Force. The Defence Minister is in constant touch with Chiefs of the Naval Staff, the Army Staff, the Air Staff and the Director General of the Indian Coast Guard. The Defence Minister had recently directed the Armed Forces to extend all possible assistance to the civil administration to tide over the impending cyclone. The Navy and the Coast Guard have deployed their sea and air assets and rescued more than 600 people from 4 barges off the Mumbai coast over the past few days. On the 4th day of its search and rescue operation of Mumbai coast, the Indian Navy today recovered the mortal remains of 23 more crew members of the ill-fated barge P305 that went adrift following Cyclone Tauktae on Monday. Subsequently, the death toll has risen to 49, while 26 people still remain missing.
Sports Authority of India will extend medical and accident insurance cover to more than 13,000 athletes, coaches and support staff from this year. This decision is to ensure the safety and well-being of all the athletes and support staff in the wake of the COVID-19 pandemic. The insurance cover of 5 lakh rupees each will be provided to all national campers, probable national campers, Khelo India athletes and junior campers training at Sai Centre of Excellence.
The Income Tax Department will launch its new e-filing portal www.incometax.gov.in on the 7th of next month. The new e-filing portal is aimed at providing taxpayers convenience and a modern seamless experience while filing the income tax returns. The portal is integrated with an immediate processing of income tax returns to issue quick refunds to taxpayers. All interactions and uploads or pending actions will be displayed on a single dashboard for a follow-up action by the taxpayer.
The government has extended the due date of furnishing of income tax return for the assessment year 2021-22 for individuals by 2 months from 31st of July to 30th September 2021. The Finance Ministry said that the decision to extend timelines for compliances under the Income Tax Act was taken in light of COVID-19 pandemic. The government has also extended the due date of income tax return filing for companies for assessment year 2021-2022 from 31st of October to 30th of November. In Kerala, the new cabinet led by Chief Minister Pinarayi Vijayan took oath and assumed charge today. The ruling Left Democratic Front has retained power, breaking the 4-decade-old convention of LDF and UDF alternating the power in the state. More from our Thiruvananthapuram correspondent.
The 21-member cabinet took the oath of office administered by the Kerala Governor Arif Muhammad Khan at the Centre Stadium in Thiruvananthapuram today afternoon. Chief Minister Pinarayi Vijayan was sworn in first, followed by the remaining 20 ministers. The ceremony was held with complete compliance to COVID protocols with a total of less than 500 selected participants. The first cabinet meeting of the new government was held soon after the function. The first section of the new assembly will begin from Monday. Mayusha, AR News, Thiruvananthapuram.
Prime Minister Narendra Modi has congratulated Pinarayi Vijayan on taking oath as Chief Minister of Kerala and commencing his second term in the office.
The former Urdu newsreader of All India Radio and recipient of the SARC Literature Award in 2014, Dr. Tarannum Riaz, passed away in New Delhi today. She was 59. She was associated with the Urdu unit of All India Radio on casual assignment basis till December 2019.
Now let us take a look at the weather forecast for tomorrow. The national capital Delhi will have a mainly clear sky. The temperature will hover between 21 and 35 degrees Celsius. Mumbai will have a partly cloudy sky. The minimum temperature will be 26 degrees Celsius while the maximum is expected to be around 34. Chennai will have thunderstorm with rain. Temperature will vary between 23 and 37 degrees Celsius. Kolkata will have partly cloudy sky with possibility of moderate rain or thunderstorm. Jammu will have a mainly clear sky, becoming partly cloudy towards afternoon or evening. Srinagar will have partly cloudy sky with possibility of rain or thunderstorm or dust storm. Leh will see a generally cloudy sky. The minimum temperature will be between 4 and 19 degrees Celsius. Gilgit will have generally cloudy sky with possibility of rain or thunderstorm or dust storm. The temperature will hover between 15 and 27 degrees Celsius. Muzaffarabad will have a partly cloudy sky with possibility of rain or thunderstorm or dust storm. The minimum temperature will be 18 degrees Celsius and the maximum will be around 33 degrees. Dehradun will have a generally cloudy sky with 1 or 2 spells of rain or thunderstorm. Chandigarh will have a partly cloudy sky with 1 or 2 spells of rain or thunder showers. And Hyderabad is likely to have rain or thunder showers towards evening or night.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi stresses on constant innovation and dynamic methods to deal with COVID-19 as the virus is continuously changing its form. Centre urges states and union territories to make mucormycosis, also known as black fungus, a notifiable disease under Epidemic Diseases Act 1897. Over 18 crore 70 lakh COVID vaccine doses administered in the country so far. Government says continuous improvement in recovery from COVID-19 being noted in the country from the 3rd of May. Active cases also on declining trend. National recovery rate of COVID-19 improves to 86.74%. Over 276,000 new cases reported in the last 24 hours. Defence Minister Rajnath Singh lauds efforts of armed forces and Indian Coast Guard in rescue operations following cyclone Tauktae. Sports Authority of India to extend medical and accident insurance cover to more than 13,000 athletes, coaches and support staff. Income Tax Department to launch new e-filing portal on 7th of next month. And in Kerala, new cabinet led by Chief Minister Pinarayi Vijayan assumes charge today in Thiruvananthapuram. For details of these stories and more, log on to our website and on our app. And with that, we end the evening news. Good night.